Hi folks, today is Friday, June 26th, and we're here on location in sunny Hampton, New Hampshire, because I have the day off, which is kind of cool. But just two things to touch on today, so we'll be really brief. One is our testing, and the second is our thoughts on the next stage of a reopening. First of all, with our testing, we tested all of our on-site residents at RiverWoods Durham and all of our RiverWoods Durham staff in this past week. We still await two resident test results and one staff member test result, but out of the 260 plus that we've received back, all have been negative. That's fantastic. RiverWoods Exeter has started its next round of surveillance testing. The previous round, all were negative. That was almost 300 people. And in Birch Hill, we had just completed our next round of surveillance testing yesterday. So we'll await those results in the next several days. One thing I would note there is we have 100% of our healthcare staff participate in that testing, which is apparently not common across the state. So we're really proud of our staff. They're willing to come in on their day off to get tested, and that's about keeping you safe and keeping their teammates safe, and we're awfully proud of them. So as we think about reopening, we think about what's next. Some really positive trends. So positive is a word that's kind of lost its luster right now, but some trends that are going in the right direction in our state are active case counts, number of new cases per day in our towns, in our counties, in our state, and in the region, in our New England region. All are moving in the right direction, some dramatically dropping. That's fantastic. We also know that across the country, some states are not having that kind of good progress. And what we're doing as we think about reopening, and this is something that the executive directors and Cindy Martin and I talk about, as I've said before, we meet 2 to 3 times a week. What we're trying to do is take the emotion out of reopening and just look at some data, because math matters in this case. We want to track the trends, and we want to understand what's important to you as we take on more risk. Because every time we do something additional, whether that's opening the campus, whether it's people leaving campus, there's more risk. And so we think about how do we mitigate that, and what have others done. And what we realize, and you all read the news too, the countries that have reopened successfully have really done 3 things. They've done contact tracing. That's been good. And so as we plan for reopening, and you'll see a detailed plan from us next Tuesday with the goal of implementing as of July 8th. Part of that will be, how do we do logging of who's where in our community and who you're around? So that will be our version of contact tracing. So countries that do well do contact tracing, they do aggressive testing. And in addition to the state testing, we have a good relationship with Convenient MD. We can call them in for testing or get test kits from them. We're also actively pursuing these rapid test machines. The reliability there isn't quite as high as a PCR test, but they're getting better. And then the third thing that countries that have done well is they enforce the concept of wearing a mask and maintaining 6-foot social distance. And that's what you can do. You can, as we move forward, you'll be able to do 2 things affirmatively. Pay attention to who you're around and log that, and we'll give you some tools to do that with. And then wear your mask and maintain 6-foot social distance. Those things will allow us the ability to mitigate as much as we can risks that would come with opening up our campus more. So I'll just wrap with that and say, next Tuesday, you'll hear from us with more detailed plan, and we'll look forward to being able to implement that plan about a week later. So until then, enjoy your weekend. Have a safe, socially distanced, good time. Wash your hands and wear your mask.